Welcome to this Academic Explainer. Today, we're jumping right into a clinical diagnosis of Thailand's health literacy progression. We're going to do this by putting the comprehensive 2019 national survey head-to-head with the recently published 2023 data. Now, health literacy is literally the bedrock of any functioning public health system, but actually measuring it, and more importantly, figuring out how to improve it, well, that's incredibly complex. So we're going to dig into the exact data points that show us where the Thai system is succeeding, and critically, where cognitive and systemic friction is leaving the most vulnerable populations behind. Let's get started.
Here's our roadmap for this analysis. First, we'll establish the overall state of health literacy. Then, we'll analyze specific health process challenges and evaluate health service barriers. After that, we'll dive into the elderly population risk, map out some strategic policy recommendations, and finally, wrap up with a really crucial caution regarding data comparison.
All right, Section 1, State of Health Literacy, Macro-Level Findings from 2019 to 2023.
So we have to start by establishing our baseline. The big question is, did national health literacy levels meaningfully improve over this 4-year period? Did all the policies and interventions deployed between 2019 and 2023 actually move the needle for the general public? Well, the top-line numbers reveal a pretty striking stagnation. Back in 2019, 80.91% of the population demonstrated adequate health literacy. Fast forward to 2023, and that number is hovering precisely at 80.9%. Statistically speaking, the national trend is completely flat, and that right there is our invitation to look a lot deeper into the underlying variables. We need to figure out exactly why that needle hasn't moved, despite 4 years of advancements in public health communications.
Moving to Section 2, Analyzing Health Process Challenges, Identifying Cognitive and Behavioral Friction.
To really diagnose this stagnation, we need to isolate the specific cognitive processes where people are hitting a wall. Remember, health literacy isn't just one single skill. It's a sequence of 4 actions: accessing information, understanding it, inquiring or questioning it, and finally applying or behaving based on it. Now look at the massive spike for the inquiry step. While accessing and understanding information sit relatively low, only about 10 to 13% of people struggle there, inquiry completely dwarfs the rest. Over 38% of people find questioning, evaluating, and interacting with health information difficult or very difficult. Basically, people can find the info and they generally understand the words, but that critical thinking step, actually asking the right questions to figure out if that information is valid for their own specific lives, that is a massive cognitive roadblock.
Section 3. Evaluating health service barriers, navigating the system.
Okay, so knowing how to evaluate information is one thing, but navigating the actual institutions of health is a whole different ballgame. The data maps difficulty across 4 distinct service sectors: healthcare, disease prevention, health promotion, and consumer protection. Interestingly, health promotion, which covers things like general wellness campaigns and basic exercise advice, is highly accessible. However, navigating everyday healthcare services, and particularly consumer protection, presents a really severe systemic barrier. Over 25% of respondents find these 2 specific areas incredibly difficult to navigate. Think about that. When people need actual clinical care, or when they need to verify if a health product is safe and legitimate under consumer protection laws, the system suddenly becomes incredibly opaque and frustrating to use.
Section 4. The elderly population risk, intersecting demographics with systemic difficulties.
While the top-line data suggests things are stable nationally, a granular demographic breakdown reveals a much more concerning reality just beneath the surface. Specific vulnerable groups are absolutely bearing the brunt of these systemic friction points. When we map those 4 cognitive processes, access, understand, inquiry, and behavior, across different age groups, we see something alarming. The difficulty of inquiry remains stubbornly high across all demographics, but crucially, look at the cluster representing behavior or application. For the 60-plus cohort, there is a totally unique, sharp spike, jumping all the way up to 22.3%. This means that even if the elderly manage to access and understand health information, they disproportionately struggle to actually apply that knowledge to their daily habits compared to younger generations.
And honestly, this demographic struggle compounds heavily when we look at the specific service sectors we talked about earlier. The elderly are having a disproportionately hard time navigating the system itself. For the 60-plus age group, their reported difficulty with fundamental healthcare and consumer protection services soars to a staggering 34%. That is huge. Over a third of the elderly population finds it inherently difficult to just utilize the basic healthcare system or protect themselves from dubious health products. It really points to the fact that the system is fundamentally not designed for their ease of use.
So, the crucial takeaway from the 2023 text is that this demographic's vulnerability, it isn't arbitrary. Remember how the national average for adequate health literacy is 80.9%? Well, for the 60-plus demographic, it plummets to just 69.7%. And the research explicitly points out exactly why this is happening. It's driven by a harsh intersection of realities, a natural decline in cognitive function, the overwhelming mental load of managing complex and compounding chronic diseases, and strict limitations in accessing digital technology, which, let's be real, is where almost all modern health information lives today. They are effectively being digitally and systemically isolated.
Which brings us to Section 5, Strategic Policy Recommendations, Evidence-Based Approaches for Intervention.
Having diagnosed the root causes, the stagnant overall literacy, the massive hurdles in the inquiry process, the systemic friction in healthcare navigation, and of course a highly vulnerable elderly population, we can now turn to the evidence-based solutions provided directly from the source material. The survey strongly recommends pivoting away from broad, one-size-fits-all national communication campaigns, because as we saw, those clearly are no longer moving the needle. Instead, policy absolutely has to target specific risk factors. Interventions need to be tailor-made for low-income brackets and those without formal education. Furthermore, the source emphasizes employing multidisciplinary approaches, meaning consumer protection agencies must work directly hand-in-hand with healthcare providers. And finally, interventions must be area-specific. A policy designed for a younger, digitally native urban center is going to fail completely if it's applied to an aging rural province.
Section 6. Cautions in data comparison. Methodological variances in global metrics. Before we wrap up this analysis, we absolutely must issue a rigorous academic caution. When we're discussing that 80.9% adequate health literacy rate, it is methodologically flawed to directly compare these percentages against European Union surveys. Now, the source texts do reference European development and validation models, yes, but the EU relies on fundamentally different predictive models and validation criteria. What constitutes adequate in the Thai survey instrument is simply not a one-to-one mapping with the European frameworks. Therefore, trying to claim that one nation is functionally more literate based solely on comparing these top-line percentages, that is statistically invalid, and it's a trap we need to avoid.
Which brings us to the ultimate challenge. We've seen exactly how localized these struggles are today, from an elderly citizen just trying to navigate a local clinic, all the way to the broader national stagnation in critical inquiry skills. So I want to leave you with this final provocative thought to consider. As health systems, digital misinformation, and chronic diseases becoming increasingly borderless and complex, how can the international academic community develop a truly unified cross-cultural metric? Because until we can accurately measure the global health literacy gap using the exact same ruler, our ability to truly solve it is going to remain completely fractured. Thank you so much for joining me in this explainer.